A very warm welcome to all our viewers to the Learn with Starchild Series. I am Meena Shah, the founder of Starchild Education and Learning. And we believe that learning must be fun and exciting for children. Today we have with us Purva Karandikar, who is an audiologist and a speech language pathologist. We are going to have a very, very interesting conversation today as we learn more about this topic. A very warm welcome to you, Dr. Purva.
Thank you so much, Meena ji, for having me here.
Yes, I'm so glad you are here. And, we have been discussing various topics in our series. And today, of course, something very different. I know what speech therapy is. However, I still do not understand completely what it is. And therefore, I wanted to ask you, so what does a speech language therapist or an audiologist that you are, what exactly do you do?
So audiology and speech language pathology is a course. It's an allied healthcare profession. So just like how you opt for physiotherapy or being an MBBS doctor, you can opt for being an audiologist and speech language pathologist. So as an audiologist and speech language pathologist, we treat patients with hearing impairment and speech language impairment. So as an audiologist, we do hearing tests. So we identify what site of the auditory pathway has an issue. We help patients with hearing impairment to be rehabilitated. So we fit them with hearing aids, or those who do not benefit with hearing aids, we fit them with cochlear implants or other amplification devices as per the case. So in audiology, we do all these things. We also help children who have listening difficulties, whose hearing is normal, but they have some issues with listening or understanding speech language processing parts. So we do help those also. As a speech language therapist, we see children as well as adults with speech language difficulty. So children usually start talking by the age of 1. So at the first birthday, they're ideally supposed to start speaking in one meaningful word. So right. Mummy ko mummy bulana, papa ko papa bulana, ya biscuit ko bikki bulana. But very meaningfully, that has to start by the first birthday.
Correct.
By 2 years of age, they start making 2-word combinations like mummy nahi, mummy come, pani do, that kind of 2-word combinations. And by 3, they have more or less adult-like conversations. Auntie ke paas gaya tha, auntie ne cake diya, aap bhi mujhe cake do. Short sentences, but they can narrate events that are happening around them.
Right.
So for any reason, if a child is not following these milestones, then we intervene. We evaluate and see how behind they are as per their chronological age. We have standardized assessments which we do so that we come to know why they are behind. So some children may not have, with today's scenario, nuclear parents, no one to actually talk to them. So they may be lacking behind with normal intelligence. Or some children have attention deficits or autism or any other syndrome due to which their communication is not developing. So in a play method, we start stimulating their brain so that the pathways are developing, so that children learn how to communicate not only with adults, with their peers also.
So how does a parent know, that the child has some difficulty? I remember when I was working in a school many years ago, and there was one particular child who was almost 5 years old. Okay, and he was only making sounds. He was making sounds, ah, ooh. He would only point out to things and say, but he wouldn't. And of course, when the school advised the mother to go to a speech therapist, she was a little hesitant because she was probably worried her husband would not agree to it. And later on,
right now, there is a lot more awareness about this. How any parent actually, we monitor their motor milestones. If the child doesn't start sitting by 7 months, you're worried. Ab tak kyun nahi baith raha hai? Yes. If he's not crawling. Same way nowadays, most of your pediatricians will actually give you a checklist with speech language milestones also. It's easily available online. So auditory as well, like, when should your child start responding to sounds, as well as when they should start speaking. Like by 6 or 7 months, they should turn their head to the source of sound. Or by 10 months, they should start babbling, saying mama, bubba. And by 1 year, they should start speaking meaningfully. So these materials are available online. So as parents, we need to be aware there is something called as newborn hearing screening. So as soon as your child is born, before discharge, you can get your child's hearing test done. Because child is never going to, like, if the child is not hearing, he's not going to probably speak. And like the typical Indian scenario, people will tell you maybe 5 saal ke baad bolega, late bolega. And by the time you start intervening, it is already late. Your brain development happens maximally within the first 2 years of life. If you don't start putting hearing aids or start hearing at that age, it becomes difficult for us to intervene later. We still have very positive results till the age of 5. If you start therapy beyond 5, it's probably very late and we don't know how much. We'll still get some results. It will be better than what it is without therapy, but the normalcy may or may not be achieved. But within 5 years, children start attending normal schools with these kind of issues also, because we work in a team. So children with autism, ADHD will work with occupational therapists, and we will make sure that we work as a team and we make sure that the child is working at an optimum level. So coming back to your first question, so as a speech language pathologist, we don't just work with children with speech delay. We also work with children with articulation issues, that is speech clarity. बोलना, 5 years के बाद भी र नहीं बोलना या blend नहीं बोलना. So we treat that. We treat children and adults with stammering. That is हकला के बात करना या double words निकलते हैं. Then adults who are professional voice users like teachers, lawyers, TV artists, they tend to have something called as vocal nodules, or sometimes even housewives, because of overuse of voice. So in such things, ENT generally recommends therapy, because with therapy, those things get resolved. So you don't need like a surgery or medication. So we treat vocal pathologies. We also treat patients with vocal cord paralysis or post-stroke patients who have lost their ability to either speak clearly or to swallow or to speak or communicate. So we have a huge caseload or a base where we actually work. We work with children with cleft lip and palate, so on and so forth. So any child who has basically communication disorder, we treat them.
Right.
Or an adult.
Yes, there's so much into it. So I also had a student, I remember. So, I mean, what I'm trying to get at is these kind of issues also create personality problems, right? I remember I had a student again who used to stammer a lot, and it was never corrected. And even today, it's the same issue. And of course, poor fellow was very inconfident, and he still is, sadly enough. So is it possible for such things to be corrected at like an adult stage also?
Yes. So at adult stage, the duration of therapy is slightly longer. It takes a lot of effort on the adult's part also. Like he has to be motivated. He has to practice the exercises. Stammering being an physiological issue, it can be corrected. There are good results that we have achieved with therapy. So yeah, it can be treated. It's just that the patient needs to be motivated. By that time, usually they're okay with their own personality. So sometimes it becomes difficult for them to give that push. But if the patient is motivated, we can definitely work about it.
Right. So how difficult are these therapies, for children? How difficult are they? Is it something which happens playfully?
They don't have to do anything. It's a playway method. Just like you were saying that how your enterprise believes in reinforcement, revision. So we stimulate them. We provide them with a lot of experience. That same experience needs to be done again and again over a period of time with parents, because parents are primary communicative partners.
Correct.
We as a therapist work for a few hours, but we teach parents as to how to communicate at home. And that experience building actually helps the child to develop speech and language skills. So it's a playway thing.
Okay. No, this is very interesting, and I'm sure there's so many parents, who would be listening in and would definitely be helped by this. So thank you very, very much for all the insights into this. Is there anything else you would like to add?
Yeah, a couple of tips to the parents, especially kids below 5 years of age. Nowadays, we tend to do a lot of screen time. It actually hampers a lot of observational skills and attention skills, and hence communication skills also. So especially kids below 2, even WHO recommends a screen time below 2 hours. After 5 years of age, screen is fine as long as it's an interactive tool and not a monotonous video, or just watching something is not helpful for language development. It needs to be interactive. So even with kids of entire age range, if you can give them interactive things where they have to participate and there is participation from either the parent or the screen or the game, that actually helps them to develop a lot of more skills. So that's just an input from, as a speech pathologist, that monitor your screen time and monitor the quality of games that you are introducing to your kids.
Right. Okay, thank you so very much. I think it has been very, very interesting. Like I said, there's so many areas which even I was not aware of, and now I am, and I'm sure it will help a lot of people. Thank you very much, Purva ji.
Thank you, Meena ji, once again. Thank you.